Hi, everyone. I'm Laurie Hutcheson, Executive Director of the Lobular Breast Cancer Alliance, and I am excited to be speaking today with Dr. Megan Kruse, the Director of Breast Medical Oncology and co-leader of the breast cancer program at the Cleveland Clinic, who's going to tell us about her new role and the new lobular breast cancer research program, or lobular breast cancer program, that launched at the Cleveland Clinic on Lobular Breast Cancer Awareness Day last October 15th. Dr. Kruse, welcome. Before I ask you specific questions about this new program, can you tell us a little about how you first became interested in lobular breast cancer and what you've been studying and finding about ILC and the motivation behind, besides our urging for you to launch this new program?
Yeah, absolutely. So, much like any of us who find a specialty in medicine that we're really passionate about, I think it all starts with a patient that really touches you, touches your heart, touches your brain, and you just can't stop thinking about it. And early on in my career, I had a couple of these patients that had metastatic lobular breast cancer. And as an early career physician, it was intense. It was intense to think about, managing someone who was very sick from all the things we talk about lobular patients can have, peritoneal involvement with fluid buildup on the belly and, these scans that are really frustrating because you don't really know what's going on, but you don't feel well. And that whole idea of just not getting answers or maybe not being heard earlier on in the journey. And those things they really hit you as an oncologist. And unfortunately, one of my early patients with lobular cancer passed away within the first few months of me meeting her. And I spent a lot of time debriefing after that with her family and with her kids and kind of going through what the experience was like. And I think those are the things where we as a community and me as a provider just want to make those experiences better, right? We may not always be able to change the outcome, but how do we make any of that journey easier for our patients? And so that really inspired a lot. And, much of this is in our world is luck when things come through. And we happen to have some really wonderful advocates in the greater Cleveland area who wanted to further the clinical impact, the research impact. And so it was like resources were there at the right time and the clinical need was there. And then, as all of you in the lobular world know, once you have the passion for this and once you get patients in the door, it kind of snowballs because this is a community of very engaged individuals. And so it's really been a great place to develop a home as a breast cancer investigator where there's a lot of people doing work, and it's hard to find your spot. So it was kind of a perfect intellectual fit, kind of emotional fit, but also the need was there from a research standpoint.
And so, can you share how you took it to the next level and how you helped motivate the Cleveland Clinic to launch this new program?
Yeah, so speaking about the resources, so we had a wonderful donor who was able to infuse us with the ability to look at topics that are specific to lobular. And I think this was in the early days before we had a lot of the research solicitations and grants that are now lobular specific that LBCA has done such a wonderful job bringing to us. But we started by like doing the basics, going back and saying like, how have our patients with lobular done? What's unique about them? And early on, we recognized that every institution is going to have a smaller number of these cases, even if you see a ton of patients. And this is really where some of the collaborations with our colleagues at the University of Pittsburgh Medical Center and Ohio State, who had already been thinking about this and been engaged in it. And it was nice to be able to brainstorm and pool our resources. And once we were able to look back at our big cohort or big group of patients with lobular breast cancer across these institutions, I think each of us were then able to use that as a springboard to say, what else can we develop? And I've seen a ton of momentum in the field with all of us advocating with pharmaceutical companies to try to move things forward, develop clinical trials there. Once you start talking about this, I think people do start to listen. So then our surgeons were saying, oh, I encounter these problems. I'd like to look at this. And we've had a couple surgical fellows who have looked at axillary or underarm management for lobular patients and how the imaging actually reflects the surgical decision making. And so it really became like a coordinated group effort. And so all of that momentum is what we have now housed under this comprehensive lobular program that we officially launched in October of 2025. And the work was already there and the people were already there, but putting a name to it and bringing it all under one house is really what I'm hoping we can continue to move forward in a coordinated manner, because now we have a program manager who helps us, and we have, our funding stream that we have that is only for lobular, and a research assistant who helps us keep moving the projects forward. And these are really the infrastructure pieces that you need to move the work forward. And so we're hoping over time we can broaden this with more, better patient education, a different flow for our patients with lobular cancers who come into clinic, maybe bringing up certain clinical trials early, tailoring the imaging plan, these sorts of things, so that we're capturing those unique elements of lobular cancer management that we've always felt, but maybe not had in practice. Doing that in a more routine way, not only to help patients, but also so we can study it better and say, hey, does any of this actually make a difference?
Oh, that's great. So I have many, many more questions, and you've answered some of them already. But so it sounds like it's its own department focused on research. Will there be, or is there already an ILC registry that's a component of this program? And if it's part of the broader consortium related to that, I'm wondering if you have like centralized pathology across the other academic settings.
Yeah, that's a great question. So I like to think of our comprehensive lobular program as being a program within a program, right? So it's its own unique focus within our greater breast cancer program. And this is what I'm now overseeing all of it. So I'll wear both of those hats. And I think that we do have a registry here at Cleveland Clinic. Essentially, all of our patients that carry a lobular diagnosis or a mixed IDC and ILC diagnosis, we are capturing the clinical information for those patients. So we can at least track things like imaging patterns, pathology patterns, treatment patterns, and outcomes. Where we are working on building our coordinated effort is in the obtaining of tissue and blood samples for our patients in a more routine basis. We are actually obtaining a blood sample for most patients with cancer who walk through the door at Cleveland Clinic. But we don't always get follow-up samples or samples that make sense for whatever treatment was done. And I think capturing samples in a time that actually reflects what's going on with the disease management or with what symptoms are actually is going to be the key to all of this. So that's part of our current program. With respect to that collaboration for the Great Lakes Consortium, um, right now, we actually don't share those specimens, and we don't have a centralized process for review. But there is a more consistent meeting for investigators from this consortium to talk about research ideas, to talk about how we would do that. So I would say we're in sort of the process development mode. And then once we've got those processes aligned, because obviously when you're working with different institutions, there's a lot of administrative hurdles that you need to address. But I think once we get our processes in place, hopefully we'll be able to do more of that sharing freely.
Oh, well, that sounds great. Is there going to be an effort to develop lobular-specific screening or treatment protocols that you'll use within Cleveland Clinic and or surveillance protocols?
Yeah, I think so. So as of right now, we have sort of an internal care path, which is we know that there are ASCO guidelines and NCCN guidelines that often inform the care of breast cancer patients in general in the US. And there is not really a specific part of that that is lobular related. We hope that one day there will be. And in the absence of that, we wanted to create our sort of own internal flow for how patients come into the system, what we should be talking to them about. And already in that, it reflects sort of the importance of breast MRI, where maybe we wouldn't otherwise be considering it. We bring up the FES or estrogen specific PET scan as part of the management and workup for patients with metastatic lobular. So these things are getting some attention, at least within our system. And those care paths are used across the Cleveland Clinic enterprise, whether you're in Northeast Ohio, you're in more central Ohio, you're in Florida, and even our international location in the UAE and Abu Dhabi. So that's getting more attention. I think right now it could be flushed out more. It's actually due for an update this month. Because the last time we update it periodically as new data comes out, but it was actually written just about a year ago. So I think that we can also look at before and after, right? Like how many people are actually utilizing these recommendations? Has that made an impact in finding new cancers, new recurrences? So it's there, but I would say we could do a better job of making sure providers, us as medical professionals, are actually doing the things that we set forth as best practices.
Oh, fantastic. Um, so, what about contrast enhanced mammograms? You didn't mention that. Is that
Yeah.
also going to be something that's a standard part of your
Yeah,
protocol?
it's coming. So we don't have our contrast enhanced mammography program up and running quite yet, but it'll be here any day now. And we did have a radiologist who was very much engaged in the lobular world, who has sort of changed her practice. So we're looking for a radiology partner in all of this to, kind of be informing our recommendations in the space for the care path. So right now, the radiologists who are overseeing the whole program are helping to inform what we would do with lobular, but we really do need a point person there. And so once contrast enhanced mammography comes, I think it will certainly factor into this. I'm not sure we entirely know who's going to be in the contrast mammography, who's going to be in the MRI group, and how we go about that. I suspect that we'll just try various ways and then see what seems to be working best. But at least once we have that program up and running, our patients will have the full complement to choose from.
That's great. So is there a specific lab focused on lobular research there, or is there going to be a particular focus for lobular research in the future?
Yeah, so we do have one of our translational researchers. She's a basic science researcher, but I view her as my translational partner in all of this, Dr. Ruth Carey, who was one of our early pioneers in actually developing even some of our general breast cancer translational research awareness here in Cleveland, and was involved very early on in the lobular symposia that happen for our community. She has an interest, of course, in this topic and is doing some basic science work. And some of her findings are the things that I'm hoping we can translate into clinical studies. But she was really instrumental in helping spearhead collecting samples for women with lobular breast cancer. And we actually have like a scientific platform now that if you wanted to do tests on sort of multiple cases of lobular cancer, tissue that we've had in the freezer for a long time, that we could potentially look for targets and different genetic changes, that is now available to all of our investigators. Um, and the best part is those clinical or those research samples that we have, those are patients where the samples were obtained a while ago. So we actually have an answer of what happened to these patients. And so if we're looking to see, which patients did really well and what's in their tissue versus these patients unfortunately had an early recurrence and what do we see in their tissue, we can actually look at those questions. So Dr. Carey's lab is doing a lot of work. And we recently had a research kind of retreat for the Cleveland Clinic Breast Cancer Program. And lobular was one of the key focuses for all of the investigators in that room. And there were many people who I wouldn't have thought that their labs would be interested in doing this kind of work said, hey, I have this technology that might actually be helpful. So I think it's actually, again, the more we bring it up, the more people get engaged and
Right.
it permeates.
So related to that, given the new focus, I'm wondering if you have sort of a decision-making entity about what clinical trials you're going to launch or accept or be a part of, and whether there's a new awareness to making sure there's including a cohort of lobular patients, or that those trials are enriched for lobular patients, and or will you be developing criteria additional to resist so that more lobular patients can be included?
Yeah, the last point you brought up about the resist criteria, that would, I think will change our world substantially. So I think I would love to be part of that initiative. And I think many of the clinicians that live in the lobular cancer world are advocating for that. And it's going to take a combined effort for sure from a number of us. I think what we do here at the local level, when we assess trials that are coming in the door, we always look for having a lobular subset in the trials. If it's not there, advocating for the sponsors to call it out. Thankfully, we have some partnerships with various companies that are running clinical trials where we're involved in the early development of the trials, where we can say, hey, I think this is what you should include, or this design would really be better if you did this to reflect our patient population. But it's not every trial. So then the other thing that we do in terms of selecting trials for our portfolio is looking for where we have holes, right? And knowing this is where knowing the disease helps you, because you can say, hey, I'm really interested in this oral SERD trial because we know that oral SERDs are really attractive and may be very effective for our patients with lobular cancer. Or, here's a new PI3 kinase inhibitor, and we see that mutation a lot in our patients. So why don't we open that trial? Um, and so we've done that across the way. And we've actually tried to broaden some of these trials that maybe were only open here at our main campus downtown Cleveland site to our regional sites. Things like first-line metastatic trials, a lot of those patients are seen in our suburban sites, so closer to home, it's easier to access. And so we're keeping an eye on which of these trials would reflect that population best. And even if it doesn't fit down here downtown, could we open it in other places? And I think this is where the awareness of the lobular just across our network and doing education about it helps. Because now when our providers see a patient with lobular breast cancer, they are thinking about some of these clinical trials. So it's a coordinated effort. I think it just takes that extra bit of attention when you're looking at a clinical trial protocol to say, hey, are we representing our whole population?
That's great. One of the things that I hope will ensue just naturally is that all of your oncologists and surgeons treating somebody diagnosed with lobular breast cancer will give them comprehensive information about lobular breast cancer, which I know isn't happening anywhere in any hospital yet, including the ones that have announced, like yours. But also that the patients will be told about the Lobular Breast Cancer Alliance, because there's no other advocacy organization like ours. And as much as hospitals are taking on the scientific and information about lobular breast cancer and sharing that, which is great. And I think, I was thrilled when I was pitching to the CDC information about lobular breast cancer needs to go on their website, and they added a
Yeah.
whole page from Cleveland Clinic and then links to us. And
Mhm.
then, of course, that unfortunately all came down. But I
Yeah.
know that you have that information to share, but I think it's still not being uniformly and consistently shared. And, even less so information about us being shared. So
Yeah.
hopefully that'll be a commitment that
Yeah.
is made and adhered to at
Yeah,
your
absolutely. We've
program.
actually thought about this with one of our actually Cleveland Clinic employees who's also a lobular breast cancer
Yes.
survivor who completely identified this need.
Mhm.
And we've really gotten some wonderful feedback from her about where the information falls short and
Great.
how different patients with lobular cancers coming through our system are getting different information. And actually, through that, we also realized that patients with breast cancer at all of our different sites of breast cancer of any kind are getting different information.
Yeah.
So how do we standardize that and how do we modernize it? Because a lot of the information we are giving has been vetted a few years ago, and we know our field has changed. And the early connection with LBCI, I couldn't agree more. I think it is just such a wonderful home, again, for our patients, for their families, for their friends who want to become more informed. And having that info in our patient education from day one is actually going to smooth everything out. I think patients who have had that exposure come to their first visit with very different questions than
Yeah.
patients who haven't had that exposure. And I think the conversations are much better when there's that background information. So Yeah, definitely part of our patient-facing, patient education plan moving forward.
Yeah, wonderful. And yes, we are working with, there's more than one patient slash
Great.
staff who we're working with. We have a big initiative. This is the year that we want to get into hospitals, probably through the providers themselves to get the information about lobular breast cancer and LBCA out. We had done a survey in December, and the Cleveland Clinic scored better than most about information, but still, having inconsistencies. So thank you for continuing. We know that LBCA is a source of comfort to people too, which is quite different from just the scientific information. We often get people coming to us asking if they make a gift to the Cleveland Clinic, would they be able to restrict it to fund lobular research? And I don't know if you can answer that question, but if you can, that would be great. If the answer,
Yeah, yeah, I absolutely can. So, we do have a very close connection with our philanthropy group. And I would say if patients and their families want to give a gift, we want to recognize the spirit of that gift and make sure it's reflecting the why behind it, right? I think a lot of this comes from that desire to, potentially honor people that have gone through this. Um, and to make meaning and sense of what an individual has gone through. And so we do have the ability to direct funds to various programs. We do have a comprehensive fund for breast cancer in general, which may have, patient access or education, all those kinds of efforts, more clinical stuff. And then we have a general research fund, which can be breast cancer research in general. And then we have a lobular specific fund. And that lobular fund is, I would say, mostly utilized for this lobular specific research, but it can be used for patient initiatives as well. And so folks who are reaching out to our Cleveland Clinic philanthropy group actually can say, I would like this earmarked for lobular use. And we will, be good stewards of that and make sure that that's where it goes. And all of those requests actually come through me. So I vet them and make sure that it really is going to dedicated lobular work before anything gets issued.
oh, fantastic. So can you talk a little bit about how patients with lobular breast cancer will be included as advisors as you're, developing your Cleveland Clinic lobular program?
Yeah, yeah. It has so far just been organic from these individuals who kind of live in both worlds, are our patients who say, hey, I want to be involved in a more formal way, or caregivers in the institution who have been touched by lobular, either themselves or through their family and friends who want to get involved. And a lot of it is just word of mouth, people coming to me and saying, hey, I want to be involved. I think we would love to formalize that in the future. And actually, we're hoping to utilize our Fourth Angel network a little bit better. So that's one of our peer mentoring programs through the Cleveland Clinic, where patients are matched with someone who kind of fits their same cancer journey. And that may be reflecting the same age, the same situation in life, the same diagnosis. And usually pairing someone who has sort of completed their active treatment with someone who's in the active treatment. And actually, that's been a great referral of patients who are interested in becoming advocates or becoming educators or speaking at programs we have. Because generally, we kind of get a sense of if a patient's ready to go from I'm experiencing this and I just want to live in this treatment phase right now and make it about my medical care to going on to that next phase of I want to be involved in the community in a particular way. So we have a few of those people now, but I think as we try to build more patient-facing initiatives, we're going to need like a core group of people who are interested in that. And hopefully, I would love to be able to apply for more, larger grants, national things. And those are all going to need a patient advocate, somebody who is reviewing the science and saying, hey, does it really make sense for patients? So I think we can get people involved in a variety of different ways. So I'd love to have like a patient council that is part of this program.
Oh, that sounds great. I guess I want to ask you if there's anything I haven't asked you that you want to talk about the new program, or anything more you want to say.
I I think as I reflect on, being in this role of leading our group, how do I use that platform as a way to further the work that we've already done? And, I think the biggest part is visibility, right? What I will be able to have in this new role is more influence over how care is given across our continuum. And I am absolutely struck by what you said, and it has been my experience that the variability is still too high. And it's really hard to measure what people say that they will do and what they actually do in practice, and the messages that are being received from our patients. And I think that I will be able to have more of a pulse on each of these sites that's in the Cleveland Clinic network now and understand what is actually happening. Where are gaps in education? Where are gaps in access to clinical trials or medications? Um, the Cleveland Clinic reach is only going to continue to grow, which means we're going to continue to touch a number of patients who have this diagnosis. And I think that's probably the best thing I can do to further the lobular, other than just being out there and getting the message out, but really saying, once we have these plans in place, are we following through with them? And I'll have more of the ability to do that now.
Yeah, and I'll do the survey again next year and see
Yeah,
how everyone
see how
does.
see what my job performance is.
Well, thank you very much for this interview. This has been great, and we look forward to keeping on top of how things evolve and all that you're doing there. It's wonderful.
Thanks so much. And thanks to you all. Thanks to the LBCA for giving us this platform. I know that our work would not be where it is right now without you all. And it's just so important to give back to this community that has been so great to us. So thank you.
Great.